Hey guys, it's Dave. Today we're going to talk about an old-time disease that we kind of wrote off the books. However, there has been a resurgence of cases in the UK, and that's rickets. Probably what's going on in England right now could be some of people that have actually moved into that country from other countries, because rickets, the reason it's gone away for the most part is because in most developed countries we now have our food that is fortified with vitamin D, which is why you see milk fortified with vitamin D, some orange juices are fortified with vitamin D, some breads are fortified with vitamin D, cereals, and so forth. It's in children is where this disease is mainly seen. In adults, it's a different disease called osteomalacia. Now, the disease affects bone development, and it's due to a lack of calcium and vitamin D. It causes weak, soft bones, slow growth, deformation in the bones, bone pain, dental issues. Your teeth are not developing, your enamel's not going to develop fully, your jaw may not be in the right formation to hold that tooth like it should normally, so you're setting yourself up for later in life to be having all kinds of issues with your teeth. It's very, very rarely genetic, but it is occasionally seen that way. It's more common in those with dark skin, because with the increased melanin, you are going to still need, though, an increase in the amount of sun that you get. It also is common in the northern hemispheres, where you don't get as much daylight, especially in the wintertime. And I know in a lot of countries in Europe, mainly Eastern Europe, they actually will give kids vitamin D as a supplement as a country. As far as what you can do with infants, especially premature infants, they're going to be more prone to be at risk to having rickets. They're also, if you breastfeed greater than 6 months and strictly breastfeed with no supplementations at all, they're going to be at a greater risk. So you need to look at adding some vitamin D, just vitamin D supplementation into their diet. A lot of things can be accomplished by just getting those little ones out into the sun. I realize busy work schedules, also in the wintertime, that's not going to happen near as much. You can get some benefits from sitting in the sun through the window, depending on your type of window, but you're probably going to need to add in some vitamin D supplementation to help out. Symptoms with that, like I mentioned before, you're going to see the bone pain as they get older. That will increase. You will see more fractures, either breaks or cracks, that can be seen because their bones are going to be brittle or soft. You will actually see that softness occur mainly in the skull as they age, and they have the soft spot in the middle of their head. That's going to be slow to fill in, and you're going to feel the softness in bones that normally should not be soft. Their teeth will not develop as early as they should. Your growth altogether, their stature, the length of their arms, the length of their legs will not be what normally they should be. Hypocalcemia, which is low calcium, which is also seen with rickets. With that is going to be muscle spasms, muscle weakness, tingling, twitching, and numbness in the fingers and the toes. In a little one, that's going to be very hard to distinguish. As they get, maybe 2, 3, they may be able to tell you about that, but that is something there. As far as prevention, what can we do? As I said, get them out in the sun as much as possible. That's the healthiest thing for you to do. Remember though, you want to watch out. You want to make sure that when they're getting in the sun, you don't have them out where they're getting to a point of getting sunburned. If you're pregnant or trying to get pregnant, women should be taking at least 10 micrograms of vitamin D a day. Look at your prenatals. If you're trying to get pregnant, you should even be on a prenatal. Make sure you look at your prenatals and make sure there's at least 10 micrograms of vitamin D. If there is, You don't have to worry about it adding to it. If you're breastfeeding, you need to continue to take your prenatal. It should have, again, like I said, 10 micrograms of vitamin D. If you're not taking your prenatal, make sure you supplement with that 10 micrograms. Babies less than a year old need 8.5 to 10 micrograms of vitamin D a day. Talk to your pediatrician or your provider about that. If they're on formula, they're not going to need supplementation because that vitamin D is included in the formula. So only breastfed or babies not on formula will need to be on that vitamin D. Now, kids 1 to 4, you should be looking at 10 micrograms of vitamin D a day. If they're getting plenty of sunshine, that's great. If you're getting a good healthy diet with fortified foods, they may not need that. Talk to your provider about that, especially if you've seen late development in their growth, if their bones have taken longer to harden, it may be a good idea to get that supplementation done. Most of the treatment that you can do should be taken care of by just getting them in the sun and getting them a calcium with vitamin D supplement. Now, for adults that have had rickets, and I have seen this with a case personally, unfortunately, you still can see some results by being on a vitamin D and calcium supplement to help strengthen those bones. You can also look at a biphosphonated like alendronate, which is Fosamax, to help strengthen those bones. A younger age person would be on that than normal, but it can still strengthen the bone. If you're on those, you need to be on a calcium with D supplement. Most likely, they're going to look at 5,000 to 10,000 units of vitamin D on a daily basis and 1,000 to 2,000 milligrams of calcium on a daily basis in adults. They also can use antispasmodics like tizanidine, cyclobenzaprine can make you drowsy. Drugs like that, methocarbamol would be another one that could also make you drowsy, baclofen, to help out, because as your bones have not gotten to their full length that they normally should, sometimes your muscles and tendons do grow to full length, and so you can have some muscle pain that way. They've used antispasmodics as well as pain meds, because even into adulthood, you will continue to have bone pain. So remember, it's real important with those little ones, and real important if you're thinking about getting pregnant or are pregnant and breastfeeding, to get your vitamin D, calcium in, and get sunshine.